My name is Christy Adornato, and my change project is improving patient-centered communication with whiteboards. Myself and another nurse on my unit discussed our change project assignment with our nursing director. She expressed her concerns for our poor communication scores and lack of utilizing the new fancy whiteboards the hospital recently purchased to enhance the communication between patients and caregivers. The most recent HCAHPS scores show that patients report their nurses always communicated well only at 76% of the time in my hospital. This leaves great room for improvement. HCAHPS scores directly affect the reimbursement we receive, and money is extremely important to our small community hospital. These scores are public knowledge available on the internet for easy access, leading patients to shop around for where they would like to receive their care. We came up with our aim together as a group. The goal of my change project is to improve HCAHPS communication scores from 76 to 90% by the end of the fourth quarter through proper utilization of our hospital's new whiteboards. There is substantial evidence in the literature to support the usage of whiteboards in improving communication. In many articles, surveys, and research showed patients were very satisfied with the boards and that they enhanced communication, improved satisfaction scores, and helped to actively engage patients in their care, all while decreasing negative impacts of poor communication and collaboration, such as sentinel events, unsatisfied patients, and even redundancies in care. Different people found different information on the boards more essential than others, but nurses, physicians, and patients all agreed on their importance. While the possibilities and potential for these boards are great, my hospital isn't the only place not utilizing them in their full potential. Segal et al. 2010 found that whiteboards aren't being utilized to their full potential or being utilized as a patient-centered tool due to the inconsistency in beliefs of what should be written on the boards, and admitted low usage rates by the staff. Segal et al. 2010 states that patient whiteboards require defined goals, thoughtful planning, regular monitoring, and ongoing evaluation. Page 236. Justice et al. 2016 discusses the importance in documenting patient daily goals at the bedside on a whiteboard in order to reduce barriers and enhance good communication practices. They state that visual display of patient daily goals via a write-down, read-back process improves comprehension of goals by all team members and improves patient satisfaction. Page 677. Some hospitals are even showing the great possibilities of interactive boards, which help keep patients up to date with information quicker than regular whiteboards and improve patient safety. When implementing this change into my workplace, there are several changes we expect to occur. The outcomes we wish to see are communication improvements between staff and patients, increased involvement in patient care, patients having goals to reach each day, and call bells ringing less frequently. In planning the implementation of this change project, we created a small pilot team to test it out. The team consisted of 2 nurses, 2 PCAs, our nurse manager, and our nursing director. We started the change on July 1st and reevaluated how the change was going on August 1st. This allowed us time to see how we are doing and what changes can be made to improve the HCAHPS scores by the end of the year to our goal of 90%. To get a baseline for the change project, my nurse manager issued a survey to patients on her tablet that asked simple questions regarding communication. She also issued a communication survey to the nurses and aides involved in the survey. These surveys are pictured on the right of the slide. To prepare everyone for our change, we had a morning huddle discussing our poor communication scores and how these new boards can really improve them when utilized properly. Expectations were made clear to the team members to become familiar with the boards and that we are to be working together, filling them out completely. Next, some changes were implemented. Markers were placed at each board, allowing patients and staff the opportunity to write things down. Essential things were passed in report from RNs and PCAs to write down, and patients were actively involved. RNs and PCAs worked together to identify responsibilities. PCAs updated things like the patient's preferred name, date, name of PCA and RN, diet, and their belongings. The RNs documented other things such as pain medications and times, medication side effects, doctors' names, and goals for the day. The aides are expected to update the care team at the beginning of each shift, and RNs and PCAs update other information as changes occur. Our manager rounded frequently to check on boards and their accuracy, frequently finding empty gaps in information or outdated information, and would kindly remind staff to please update their boards. We regrouped weekly to find and discuss difficulties we were having, such as communication between team members, on who fills out what, missing markers, and lack of time to do this. Our director silently rounded, providing insight she received from patients. We found that staff were more compliant with keeping boards up to date when they saw the director rounding to enforce the change. Changes were made as needed, such as taking markers away from the boards so they wouldn't disappear and only allowing staff members to hold them. And communication was improved between nurses and aides to hand off essential information nurses expected aides to write down on the boards. The next cycle of this change will include the entire unit and be enforced on other units after that. We will make changes to alter boards to make them more unit-specific. Eventually, we can enhance physician communication by encouraging their usage of the boards with patients, writing their names and phone numbers and goals with the patient when they round. Expected results. At first, I expect staff to have a lot of resistance towards taking the time to fill out whiteboards completely. After the 1-month trial period, the staff survey and patient survey will have improved results from July 1st to August 1st, with 75% of answers of either usually or always. Eventually, when carried out well, I expect to see a 50% decrease in call bells ringing because patients won't be ringing to ask questions that were already communicated and written onto the whiteboard. Finally, although my goal is 90%, I expect HCAHPS scores related to nurse communication to improve to 83% by the end of the 4th quarter, and they will continue to improve after that. 90% is a tough goal to reach, and I realize that. Actual results. Patients and families showed an increased involvement in patients' care, notifying staff when information on boards was incorrect, and discussing goals, pain management, and other information on the boards. Nurses and aides started to work together and communicate more. 90% of patients interviewed by the manager and director found the whiteboards to be a useful tool in improving communication and keeping them up to date on their care. Nurse and patient surveys showed great improvement. At the beginning of the change project, the staff survey answered sometimes to almost all of the questions. After the month trial period, they all answered always or usually. The answers to the patient survey also showed great improvement, with 50% of patients answering usually or always before the start of the implementation and 80% after 1 month period. Evaluation. In order to improve this project, I would suggest we find a way to attach markers to the boards to keep them from disappearing. Lack of a marker round was a common reason why staff and patients alike failed to write things on the boards when they wanted to. I would also recommend magnets with staff members' faces to allow patients to remember what each member of their care team looks like, putting a name to the face. Finally, it will be helpful to alter the report handoff sheets our aides use to include everything on the whiteboard so that these essential things are reported off at shift change. In order to sustain this change, rounds will have to be continued at unannounced times in order to ensure compliance as time goes on. In the future, to improve effectiveness, we can make these boards more unit-specific. We currently have the same boards on all of the units in our hospital. One day, it would be great to get more advanced and implement more interactive boards that I have read about on the internet, which keeps patients very engaged in their care.